Every year, nearly 45,000 people in the United States are diagnosed with a primary tumor in the brain or spine, and more than 24,000 Americans will find out they have a primary benign brain tumor. But being diagnosed with a brain tumor doesn't have to be the scary monster that it once was. Experts in the field are making huge strides in the diagnosis and treatment of brain tumors.
My wife had been experiencing headaches for a few months, more than usual. They did an MRI and discovered that there was a mass inside the skull on her brain.
For anyone, the diagnosis of a brain tumor most certainly sounds frightening, but the truth is, with medical advancements in neuroscience, a brain tumor can be treated with surprisingly high success rates.
It's scary, but it's just something you have to deal with.
The Pattersons were lucky to catch it early, and she's now on the road to recovery. Although their lives were turned upside down in a matter of weeks, the experts at Eden Medical Center were able to set things right again.
There's a lot of anxiety when anyone is told they have a problem with their brain.
Dr. Lawrence Dickinson is just one of a very talented group of medical professionals that specialize in the surgical treatment of neurological disorders. Their patients cover all aspects of medical problems involving the brain, tumors, aneurysms, strokes, even chronic back and neck pain. Their combined efforts have helped the hospital earn a great reputation and have earned several accolades in the medical field. A recent report by the state of California names Eden Medical Center as one of only 2 Bay Area hospitals with a better than average mortality rate for craniotomies.
A low mortality rate and complication rate for craniotomy doesn't happen by luck. It was a strategic plan that took 10 years to implement here at Eden Medical Center. Instead of having lots of hospitals doing cranial surgery, we would take 5 or 6 of the hospitals, basically all of the institutions in the East Bay, and create one neuroscience center. And so by taking instead of a population of 50,000 people that our hospital covers, we now cover well over 500 to 750,000 lives. Now everyone on your team is that much more experienced.
And it doesn't end with experienced doctors. The standard of care extends to the nursing staff and the rest of the team at Eden Medical Center.
I think that's critical to quality care for patients and for particularly for brain tumors, aneurysms, and intracranial disease, is that you want a nursing staff that are basically, that's what they see day in and day out.
The symptoms of a brain tumor often begin with a severe headache, but how can you tell if a headache is just a headache and not a sign of something more serious?
Often when the headache is caused by pressure inside the head, it is associated with nausea and feeling sick. Not unusual for people to have vomiting. Also, we find that a lot of times with brain tumors, it's the swelling that they cause is more prominent in the morning, so often you wake up with the headache from a tumor.
So if a person is experiencing the type of headaches that Dr. Dickinson was showing us, how do you know if it's just a headache you should take a couple aspirins for, or if you really need to go to the doctor because it might be a brain tumor?
Well, fortunately, Peggy, the vast majority of headaches are not caused by brain tumors. And so headaches can be treated very effectively, and people who have those problems should see their family doctor or neurologist. If there's something unusual about the headache that warrants further evaluation, fortunately now we have sophisticated imaging studies that allow us to have a very clear idea of what's going on in the brain, and if there is some sort of tumor or other abnormality, it can be easily recognized.
Right, and so you were talking about as far as when you came in, if you were suspecting a brain tumor, would you get an MRI, would you get an X-ray, what sort of things would you do to determine if it was indeed a brain tumor?
Well, there are a variety of studies that can be obtained, but the most valuable is an MRI scan. These are now immediately available, and an MRI scan will give us a great deal of information about what the structure of the brain looks like. And if there's a tumor there, we'll certainly see it on an MRI scan.
And if there is a tumor there, surgery, other options, what can you do?
Well, it really depends on where the tumor is and whether or not it's causing problems. Again, with these advanced imaging studies, we're now finding tumors more and more in people who have no symptoms whatsoever. And in those situations, sometimes we'll just follow a tumor and not necessarily rush to surgery. And if there's a change over time, then at that point we can consider an operation. For a tumor that's getting larger or is causing symptoms, then surgery is usually the first order of treatment. And as a neurosurgeon, my goal is to remove a tumor completely, but the patient's safety is top priority.
And most of the time you don't do this alone. There's a real team approach over at Eden.
There really is. We have a tumor board that meets weekly or sometimes bi-weekly, where we talk with about individual patients with a variety of specialists, radiation oncologists, neurosurgeons, medical oncologists, to try to come up with a specific treatment plan that's tailored to an individual patient.
And it seems like it's working. When I was over there, I actually got to visit one of your patients that 4 hours after having a brain tumor removed was able to sit up and talk and communicate as if, you know, just went in to have a little mole removed. So the recovery time seems pretty amazing.
It's really changed. Oftentimes these can be done without shaving any hair, for example, through small incisions, and patients sometimes going home the day after surgery.
So even though it's complex, you can actually, as a team, you can actually get through that and get a better recovery.
In general, patients recover faster. Psychologically, they do better, get back to work sooner, and get back to their normal lives, yes.
That's a good outcome for everyone involved. Well, another complex problem that affects a lot of people is pain. People who suffer with back pain often say there's no such thing as quality of life, but sometimes they fear surgery, and that fear keeps them from seeking help. When we come back, we'll tell you how Sutter East Bay Neuroscience Center at Eden Medical Centers are using minimally invasive spine treatment programs to improve quality of life.